Hi learners, it's Em from Sononerds, and this video is on Unit 23, Sonographer Safety. Unit 23, Sonographer Safety. A small part of the physics test is dedicated to sonographer safety and what it means to be working in the clinical setting, taking care of patients, infection precautions, and some legal considerations. Sonographers need to be highly knowledgeable about their machine, anatomy, physiology, pathology, and physics. But this career also includes knowing how to take care of patients, communicate with other healthcare workers, and how to protect their own bodies from the side effects of working in healthcare, specifically sonography. Let's take a brief look at these concepts, again, just to give you a basic overview of the topics as they may show up on your boards. Before getting into the unit sections, I do want to point out that there are a list of definitions in the workbook. If you understand these words and what they mean, you'll have a really good working sense of what it means to be a sonographer in the clinical setting. Section 23.1, Sonographer Safety. Sonographers are exposed to a lot of diseases and pathology during their workday. It is important to know how diseases are transmitted from person to person so they can break the chain of infection. Sonographers are often involved in sterile procedures and should know how to set up and operate in a sterile field. Sonographers are also their own best advocate for promoting safe working conditions and proper ergonomics. As a healthcare worker, you will want to protect yourself from contracting diseases that your patients may have. Some of the most common diseases that are found in the clinical setting and pose concern for transmission include hepatitis B and C. This is caused by viruses and drug use and is transmitted through infected bodily fluids. As healthcare workers, it is not uncommon to need a hepatitis B vaccination to work in healthcare. This is because of the high transmissibility of hepatitis B and C through something like an accidental needle prick. We also have the human immunodeficiency virus, or HIV. This is the disease that leads to AIDS, and it is also spread through infected bodily fluids. If you are accidentally exposed to bodily fluids containing HIV, you may need to start antivirals as soon as possible to prevent infecting yourself. Another one is tuberculosis, or TB. Tuberculosis is an airborne disease. It can be spread by coughing, sneezing, speaking, or even singing. Healthcare workers are usually tested for TB prior to working and then yearly afterwards. Another one is methicillin-resistant Staphylococcus aureus, or MRSA. This is a Staphylococcus bacteria that is resistant to antibiotics. And this is often spread through close contact with a person that has a wound infected with MRSA or even just has MRSA living on their body. Another common hospital disease is something called Clostridioides difficile, shortened to C. diff. C. diff is a bacteria that can overtake the bowel after a patient has been on a long run of antibiotics where their good bacteria are depleted. This causes the patient to have diarrhea and is easily transmitted through spores that can be picked up from close contact. When dealing with infectious diseases like those discussed previously, or even more benign infections like the flu or the common cold, there is a clear path or chain of events that causes infections. First, we have to start with some sort of pathogen. That's going to be a bacteria, virus, fungi, parasite. The pathogen needs to live somewhere. That's the reservoir. And for our purposes, we're thinking mostly people, but reservoirs can also include animals, soil, food, and water. The pathogen needs to find a way out of the reservoir. That is the portal of exit. For humans, that tends to be either coughing and sneezing, bodily fluids or secretions, or even through feces. Once the pathogen has left the reservoir, there has to be some sort of mode of transportation. How does it get to the next place? Oftentimes, that's going to be through a direct contact, indirect contact, like being an airborne disease, or through vectors like other animals. The pathogen then needs some sort of portal of entry into the next host. For humans, that tends to be our mouth, our nose, and our eyes, or cuts in the skin. Once the pathogen enters a body, if the host is susceptible to that pathogen, they then become the reservoir. Susceptible hosts tend to be elderly, infants, really anybody who's immunocompromised, but technically anyone can be the susceptible host. It really depends on how good their body is at fighting that pathogen that has entered, and then the chain continues. When a person catches a disease while in the hospital, it's called a nosocomial infection. Nosocomial infections are also called healthcare-associated or hospital-acquired infections, and they are a subset of infectious diseases acquired in the healthcare facility. To be considered nosocomial, the infection cannot be present at the time of admission, but rather develops at least 48 hours after admission. So when we're looking at the nosocomial infections, we're really talking about patients in the hospital getting infections. And that's really going to be like your MRSAs and your C. diffs, and as this image shows us, even some E. coli and Candida. Some of the bigger causes of nosocomial infections are probably going to be more of your indwelling devices, such as catheters or even ventilators. But as sonographers, if we are visiting a patient's room and then going to another patient's room, we can also be that vector for transferring infections around the hospital. So our goal is to break the chain to protect ourselves and our patients. And we are most effective at doing this by controlling either the portal of exit, mode of transmission, or portal of entry. So that really means getting immunizations, using good hand hygiene, using personal protective equipment, and always cleaning our instruments. Now, the easiest and best way to break the chain is to wash your hands. Now, this can be done very quickly by using the hand sanitizer before entering a room with a patient and then after leaving the room with a patient. And then also washing your hands with soap and water should always be done when hands are visibly soiled. Other ways that we take care to break the chain is by using universal precautions. This means that there's a standard of care observed with every patient to avoid transmitted diseases. For sonographers, this typically means wearing new gloves for every patient and cleaning the bed and transducer. During pandemics or even during the flu season, it might be necessary to increase your universal precautions to masks and goggles to, again, prevent the spread of disease from patient to patient. When a patient is known to have a communicable disease, their room is often designated with signage that tells practitioners how to protect themselves and the patient. These patients are in something called isolation and are classified as either contact, droplet, or airborne precautions. In this image, we can see some examples of the types of signage that you might see on a patient's room. For example, the contact precautions tell us that we need to always wash our hands, which is a given. You'll want to wear a gown and gloves when you are caring for this patient. Before leaving that room then, you take off all of your protective equipment, leave it in the room because that room is the contact precaution room. Leave the room, clean everything up before heading to your next patient. It's important that we don't take the disease that contact isolation patient has and bring it elsewhere in the hospital. This is where we are very important in breaking that chain. We use proper protective equipment, leave it in the room that we are in, and clean our equipment before heading to another patient. This is just another example of listing out the contact precautions, droplet precautions, and airborne precautions that you might see within the hospital setting. It again tells you what to do with the patient, what type of signs are needed, what type of personal protective equipment or PPEs are needed, and how to transfer that patient through the hospital. As a sonographer, you will be involved in procedures that require a sterile field. This may be in a surgical suite or within the radiology department. Ultrasound probes cannot be sterilized due to the chemical or high heat that is needed. However, they should always be cleaned with a high disinfection agent. Sterile probe covers are usually used for procedures when possible. You should also make sure that your ultrasound machine is clean prior to a sterile procedure to reduce the pathogen load. This will mean wiping down all of the surfaces. As a sonographer, you should be comfortable with creating a sterile field, what it means to set it up for each procedure that you are involved in, or how to appropriately enter into the surgical suite. There's a lot more to this video, and it is linked in your workbook, and you can watch it with directions as provided by the video. When working with a sterile field, there are a few things that you should remember. Always be aware of what is sterile. So that means what on the tray is sterile, what in the room is sterile, what can you touch, what can you not touch. If an object's sterility is questionable, then you must assume that the object is not sterile. If you look at something that you know should be sterile, but you're not 100% sure that it is, assume that it's not and replace the item. Never reach or lean across a sterile field. By doing so, you have made the field unsterile. For a person to be considered sterile, they must wear a sterile gown and gloves. The cuffs of the gown are not considered sterile, however, they are typically covered by the cuffs of the sterile gloves. The edges of a wrapper are not sterile, so if you are not sterile, you can touch the edges of a wrapper. However, the person wearing the sterile gloves cannot touch the edge of the wrapper. So quite often you'll see the person who is sterile wearing the gown and gloves will ask others to introduce new items into the sterile field if they are needed. Make sure that you never leave a sterile tray unattended. This kind of goes back to the sterility question. How do you know 100% that if you left a tray by itself, unattended, that nobody came in and licked things or touched things? So never leave a sterile tray unattended so you can confirm that all the objects remain sterile. And then lastly, if something becomes contaminated, it cannot go back to the sterile field. So we really don't want to drop something on the floor, pick it up real quick, and then throw it back on the sterile field. It's going to make everything unsterile in that field. This section on sterile field is by no means exhaustive, but at least should give you some basic knowledge that you can apply if you were to get questions about it on your tests. Practicing good ergonomics is going to be the cornerstone to a long-lasting career in sonography. Ergonomics is an applied science concerned with designing and arranging things people use so that people and things interact most efficiently and safely. For sonographers, that means arranging the patient, the bed, machine, and your body in a way that does not cause harm from extraneous use or repetitive use. When you work in a field like sonography, you are more susceptible to injuring yourself. And these are called work-related musculoskeletal disorders, or WRMSDs, sometimes even referred to as repetitive stress injuries, or RSIs. WRMSDs in sonographers typically manifest as pain, swelling, numbness, burning, even a pins and needles feeling, and other muscle and joint-related issues. Official diagnoses tend to be along the lines of tendonitis, bursitis, pinched nerves, and more. WRMSDs can be apparent in the hands, the wrists, elbows, neck, spine, and hips, but most commonly, sonographers will experience pain in their shoulders. In the workbook, I have linked to the SDMS article about work-related musculoskeletal disorders. One of the most surprising facts in there is that 90% of sonographers are scanning in pain. So you really need to take care of your body by practicing good ergonomics for every patient whenever possible. The article highlights tons of ways to prevent work-related musculoskeletal disorders, but I do want to just highlight a few of them here for you. You want to make sure that you keep the monitor at eye level. You shouldn't be looking down at the monitor or looking up at the monitor. You want your neck in a nice neutral position. That's kind of the key for a lot of this. Keep your joints and your muscles in neutral positions. You want to make sure to keep your body aligned, so avoid leaning or standing more onto one foot. Take breaks to stretch your muscles, to give your muscles some time to rest. And the two biggest things that will help you with your ergonomics is to make sure to move the patient as close to you as possible. If they are mobile, ask them to scoot towards you. You want them right next to you. You don't want to be leaning or stretching to scan these patients. And lastly, make sure that your scanning arm is no more than 30 degrees abducted. So abducted is the motion of lifting your arm away from your body. That's abduction. Bringing your arm back towards your body is adduction. So you can think of adding your arm to your body is bringing it closer. Abduction, if somebody is abducted, they're taken away. So you can think of abducted as taking your arms away from your body. So when you're scanning, you do not want your elbow and shoulder angle to be more than 30 degrees. So by moving that patient close to you, you are not reaching. By either standing or sitting or moving your chair appropriately, you can keep your shoulder in a more neutral position, aiming to keep it 30 degrees or less. And just on the bottom here, a little graphic again, try to keep that shoulder in a very neutral 30 degrees or less position. The further you bring it away from your body, the more stress you're putting on those muscles and joints. Section 23.2, Patient Communication. Communicating clearly with patients is both patient and sonographer safety. There are rules that we need to follow professionally, ethically, and legally to protect ourselves, the institution that we represent, and most importantly, the patient. An ultrasound can only be performed with an order from a qualified provider. This will be usually a doctor, physician assistant, nurse practitioner, or certified midwife. They will choose what type of ultrasound is appropriate for their patient, and a written or electronic order is submitted. Prior to starting an exam, you will need to identify your patient. At the very least, you need 2 patient identifiers. This is typically going to be their full name and date of birth. Confirming the ordering provider's name and the intended ultrasound is also appropriate and good practice. In the outpatient setting, this is normally confirmed verbally with the patient. In an inpatient setting, verbal identifiers are appropriate, but the sonographer should also verify information found on the patient's wristband, including their name, date of birth, medical record number, and doctor. As a sonographer, you should be able to communicate to the patient about the ultrasound equipment and relate basic information about ultrasound and medicine to a patient. Remember that communication happens in both verbal and non-verbal ways. Not everyone speaks medical, so make sure that you are using lay terms when possible. Always use an interpreter when necessary. You should always be offering your patient a medical interpreter when you are not speaking in a language that the patient is proficient in. It is better to use a medical interpreter versus a family member because the medical interpreter will accurately interpret for the patient. Family members might censor or not quite understand what you want to communicate. Medical history is also pertinent to the sonographer and the final read of the exam, so you should know what questions are relevant to the exam you are performing and what information from the health record you will need. Some good questions for a patient that's symptomatic might include: where's the problem or area of pain? When did the pain start? How severe is the pain? What relieves the pain or causes it to worsen? And what else happens when the pain begins? There are also good questions to ask for the asymptomatic patient, such as: are you a diabetic? Do you have high blood pressure or cholesterol? Do you smoke? Do you take any medications? And have you had any surgeries, especially related to the examination area? Before any invasive procedure, make sure that you always get informed consent. This usually includes the patient being told the benefits and the risks to the procedure or exam, and then giving them the option to continue. Note that they can always revoke their consent at any point. Protecting the patient also means protecting their protected health information, or PHI. A law passed by Congress in the United States aimed to do this. The Health Insurance Portability and Accountability Act, which is abbreviated as HIPAA with 2 A's, not 2 P's, has 4 goals: to standardize record release, protect health records, apply penalties for violations, and provide more patient education. Some very basic ways that we as sonographers can acknowledge HIPAA and protect patients' information is to make sure that we're turning our computer monitors off, turn any screens away from patients' view that might have other names on them, dispose of paperwork in appropriate areas, such as shred bins, not into your regular garbage, never discuss patients in a public setting, and never access medical records that you have no business being in. If they are not your patient, you should not be in their medical record. Section 23.3, Sonographer Ethics. This last section reminds us that we are professional healthcare providers. Your ethics and professionalism will forever shape your career. I urge you now to choose who you want to be as a sonographer. Why are you choosing this career? Are you ready to put in the hard work and long hours so you can serve others? As a sonographer, you will be an important part of the healthcare field. At school, during your internship, and for the rest of your career, you will be expected to act ethically and be a professional. You will need to use independent judgment and systematic problem-solving methods to produce high-quality diagnostic information and optimize patient care. You will promote excellence in patient care by fostering responsibility and accountability among diagnostic medical sonographers. You are responsible for preserving the integrity of our profession. The Society of Diagnostic Medical Sonographers is a national membership group that organizes and advocates for sonographers. The next page summarizes our profession's code of ethics. Please make sure you read through them in the workbook and think about how you will work within this code as a sonographer. So here's a very brief overview of the Code of Ethics put out by the SDMS. Again, I'm not going to go over them. You are free to read them, and I've also linked them in the workbook as well. Being familiar with these will really give you some direction and ownership to what your role is as a sonographer in taking care of patients. And that is it for our Unit 23. So again, we just kind of covered some basics of being a sonographer in the clinical setting. Really look through those definitions. If you kind of know what all of those words mean, you'll have a really good basis of knowledge for your boards. The rest of the lecture really tried to expand on those definitions a little bit more, give you some context to use them in. And while this might not feel exactly physics related, there are sections on all of the boards that cover a little bit about patient care and sonographer safety. There are no activities in the workbook for this section, as a lot of this is just kind of understanding the roles you play as a clinical sonographer. So I do encourage you to read through the Code of Ethics and really just do some self-reflection on how you can elevate the world of sonography. There are, however, some nerd check questions, just again, making sure that you understand the concepts that were presented in this lecture.